about very common, we've been seeing a lot of advertisements, or not advertisements, it's something very common, it's something new to many of us, that is injections in orthopedic procedures. So, what are these injections exactly, doctor? And are they actually more effective than surgery, like some of them claim, or do they actually replace surgical options?
Okay. Injections are not new. Injection always been there in orthopedics.
Okay.
Only things we used to use different type of injection in the past.
Uh-huh.
Okay. If you can take two common conditions. One is arthritis in the knee or a tendonitis. There are two normal conditions where we get to inject or do some injection. Normally, if the patient's got early stage of arthritis or early tendonitis, you start with medications or medicines.
Okay.
Some of the people do not respond to these medicines or they have intolerance to that. Then we try to get somehow a higher level of therapeutic. That means we try to do injections into this patient.
Okay.
There are different types of injections available in the market. Right from injecting, you can inject steroids. That was being done quite a few times for the last few years. We've been usually regularly doing steroid injections for the last probably 2-3 decades. If the patient has CP pain, we still do it in some conditions that we still inject steroid injections into the joint to give pain. The recent what is the popularity for injections in orthopedics is mainly due to these new generations of what we call as PRP, platelet-rich plasma stem cell injections.
Okay.
This is a new branch of orthopedics where it's called regenerative orthopedics. We're trying to regenerate the cartilage, regenerate the tendon. I think that's the way interest is.
Oh.
So normally what happens if a cartilage is damaged in the knee joint, we can do a replacement arthroplasty. But what we're trying to do now is to regenerate the cartilage, the damaged structure, if we can regenerate by different means. So the PRP, which we call as a platelet-rich plasma, where we take blood from the patient, a venous blood, centrifuge in the machine, and we get 3 to 4 ml of blood or serum, which has got growth factors in it.
Okay.
So if we inject these growth factors into the joint, into the tendon, what happens is they have a tendency to regenerate the cartilage or regenerate the tendon.
Okay.
I think that's the principle behind it, that you're trying to do regeneration therapy rather than replacing it. So once it regenerates, the cartilage tries to get back to its normal, and the patient gets better.
Okay.
The only drawback with this procedure is it has to be done in the early stages. So if you're going to do arthritis, it has to be done in the early stage of arthritis, stage 1, stage 2, when the early damage is there.
Okay. Okay.
If the cartilage is completely worn off, or you come to grade 4, probably this will not work.
Okay. So you're saying.
So we'll have to, it has to. The time frame is important. I think if in early cases, early arthritis, it does help those patients.
Okay.
It tends to regenerate or they pick up. But there's still evidence. There's not complete evidence now. I think it's a growing evidence in the last 5 years now, and probably another 5 years you might be a bit more into detail about this PRP stem cell therapy and how good they are. But this is not in orthopedics; it's all specialty they've been using it.
Okay.
Plastic surgery and dermatology, everyone uses this type of regenerative therapies now.